So how does orthopedic manual therapy work? Biopsychosocial, very important, foundational in the Maitland technique, Maitland approach. It's patient-centric, and there's a lot of good research on it. We're talking about the biology of the patient, the specific gender, physical illness, disability, etc. of that individual patient. The psychology of that patient, their learning, their memory, their attitudes, belief, personality, behaviors, emotions, coping skills, past trauma, both physical and emotional and psychological. And in the social context, what sort of social support does the patient have? What about family background? Cultural traditions, important. Socioeconomic status, their education, what they perceive as what's going on. So I like to say that the bio of this patient varies with the stage of the disorder, and as a consequence, you have multiple effects occurring over multiple timelines. The patient changes over time. The acute red-hot lumbar disc that comes in, certainly they've got a disc problem, but it's a multifactorial problem. You don't just upset your disc without becoming emotionally upset and fearful as to how it's going to affect your life and your ability to be a student or a clinician, how it's going to affect your wife and kids, etc. So first let's look at mechanical. The mechanical side of mobilization and moving stuff around. The mechanical effects have been shown to improve movement and thus reduce pain. That's the really old school, that's what we do when we do mobs, is we give the joint a good stretch and we reduce the pain. There's great research on the anti-inflammatory effects of a joint mobilization, including reducing inflammatory mediators and actually reducing inflammation by mobilizing that joint. Neurophysiological is enormous. The neurophysiological aspect of mobilization improves pain and thus allows for improved movement.